Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. Thank you to our Pedo Teeth Talk sponsor, Ufredi, for helping us bring you great content. We couldn't do this without them. Visit them at www.hufredi.com. That's HU-FRIEDY.com. We're here today with Dr. Paul Casamassimo, one of the great ones in our discipline of pediatric dentistry. Paul received his dental degree from Georgetown and his Master of Science and Certificate in Pediatric Dentistry from the University of Iowa. He's previously taught at the University of Iowa and the University of Colorado. He is editor emeritus of AAPD's journal Pediatric Dentistry and also past president of AAPD. Paul has done so many things, and I'm going to urge our audience, specifically in the case of Dr. Casamassimo, to look online at the course description here for the podcast and see Paul's full bio. It is very impressive. He's board certified in pediatric dentistry and practices at Columbus Children's Hospital. He has done it all in our specialty of pediatric dentistry. Paul's published over 400 articles and is an expert on many aspects of our specialty, including care for the disadvantaged, and just overall has weighed in. He's also the head of our policy center, the chief policy officer of the American Academy of Pediatric Dentistry. He is serving in the Ohio State Medicaid program and as a policy consultant, and he is section editor for the upcoming U.S. Surgeon General's report on oral health. Paul and his wife, Maureen, are proud parents of 3 children and grandparents to 4 children and have resided in Columbus, Ohio since 1988. Paul, thank you so much for being with us today to talk about this very important subject of the AAPD Workforce Report. Thank you, Paul, for being here. So, Paul, what is the Workforce Report, and why did the AAPD commission this study?
Well, Joel, thanks for the introduction, and it's a pleasure to be here. The workforce study was conceived by the leadership of the Academy in response to several things. The first was about 2 decades worth of working with the federal government to try to increase the number of pediatric dentists in the country to meet the needs of children in all areas and people with special health care needs, because, as you know, pediatric dentists carry the burden and the load of that population in terms of seeing those patients. We were also interested in looking at the veracity or the validity of concerns on 2 sides. One is that in certain areas there were seemingly too many pediatric dentists, and on the other side there were areas of the country, geographical and population-based areas, where there weren't enough. And so it was, I think, our responsibility as a professional organization to our members and to the children that we serve to try to really better understand the distribution of pediatric dentists in the United States, and also to try to crystal ball the future and see what things needed to happen to make sure that there was always access to a pediatric dentist when a child or family needed it. So that was our basic purpose. Secondarily, based on the result of the workforce study and other information like our practice survey that we do periodically, is to try to provide advice to new pediatric dentists and also to agencies and other governmental bodies on things they needed to know about the availability of pediatric dentists in different areas. So that's why we did it.
So a lot of our colleagues, Paul, are talking about this workforce report. I see it on some of the blogs, on Facebook, on everywhere, and it's obviously of a lot of interest to pediatric dentists. Can you tell us, in summary, perhaps, what some of the main findings of the study were?
Sure. The study is pretty intensive. It involved a group out of Albany, New York, that does workforce studies in all health areas for organizations and for the federal government. So we were very confident that the information that we got was useful and valid. The two main findings were that the number of pediatric dentists is increasing and will continue to increase at current capacity of our training programs. And so we will move from about somewhere between 5,000 and 6,000 pediatric dentists to about 10,000 or more by 2030. And that projection is based on birth rate and location and the productivity of our training program. So that's the number one finding. The number two finding, I think, of relevance is that, like many health professions, dentistry and medicine, there's a maldistribution, and practitioners tend to be located in population-dense areas, maybe areas that have more social and other amenities, and also employment opportunities for patients and for spouses of health professionals. And we're no different in pediatric dentistry. We are concentrated on the East Coast and the West Coast, with the Midwest and the South being less populated by pediatric dentists. So the two take-homes are the numbers are increasing in a relatively slope-like curve, not precipitously, but definitely increasing, and that also the distribution of our specialty really is reflective of the population in general.
So when we look at this study as workforce projections, is it consistent with data we have on pediatric oral health and practice in the U.S. from other sources?
It is. The population distributions are in sync with what we see, so that it's very logical that our membership would move to areas where there are more children and more opportunity, thus to establish practice, because about 3/4 of our members are in private practice, and so that's where the patients are. The federal government, tends to think that dentistry is maldistributed across the country, and our findings are pretty consistent with their findings, that there are shortage areas, rural areas, for example, and areas of low population that may or may not support a full-time practice. So we're pretty consistent. I think maybe where we have some differences with government agencies is that I don't know that the skills and the reach of pediatric dentists within a healthcare system are appreciated. We're kind of just looked at as a digit like any other health professional, without looking at the nature of our practices and how we can actually handle numbers of patients and deliver preventive as well as treatment services. So there's a little disconnect there, but basic numbers and distribution, I think, are consistent
with others. So it seems like the data that I've read in your report, in this report, is that we have enough pediatric dentists for the foreseeable future. What factors could affect what actually happens between now and, let's say, the 2030 timeframe?
You know, these projections in any health field or in any field, I think, come along with a whole basket of assumptions. And the assumptions that were made in our study, were that population growth would stay the same, and that the birth rate was stable, and so that the number of children in any particular area would be about the same. And So again, it's a cross section in time, and so that may change. That's one factor of more kids or fewer kids, depending on how society moves forward. The second one, which I think is percolating, and if our listeners have looked at the literature and the professional announcements of organizations, there is some questioning about the safety of fluoride in the water. And we still, as an organization, and I think dentistry as a profession, still recommends systemic fluoride in water systems. But there's closer scrutiny being given to water fluoridation and access of people to water fluoridation for fear of its effect on the neurological system and secondarily to the renal system. So we may see a change, and we may actually see some municipalities stopping fluoride in the water, and that may lead to an increase in caries. So that's
Yes.
just one example of something that might happen.
Yeah, that's a good one. That's interesting. We are definitely seeing at least a backdrop of more concerns being raised about fluoride. It's interesting to hear that. You know, after this workforce report came out, there were a lot of postings on various sites that talked about concerns that pediatric dentists may have. Are they feeling a pinch that there are too many competitors? We've produced too many pediatric dentists. Is that a valid concern?
I think in some areas it is definitely a valid concern, but the choice of location is always the individual's choice. So I think anyone planning to go to a population-dense area runs the risk of being in a very competitive environment for pediatric dentistry. That being said, there are many, many places in this country, and not too far removed from the densely populated areas, where a pediatric dentist can go and be busy. In fact, one of the findings of the workforce study was a question that asked about the pediatric dentist's respondents' perception of a shortage of pediatric dentists. And if you practiced in a smaller community, you were asking for help. You felt there was a shortage of pediatric dentists. And conversely, if you practiced in a major city, you said, we've got enough. We don't need any more. So,
Right.
You know, it really is dependent on where you are in terms of what the opportunities are. So truly, some areas are saturated and others are just open for opportunity.
So that's also a very interesting finding that I read in your report, in the report. And so if you're going to give advice, if you're going to give career advice to somebody starting out in their career as a pediatric dentist, what specific strategies for determining amongst all those location options, such as those to which you referred, would you base your analysis on? How would you look at the data?
Well, I would say that there are definitely some areas that, unless you are tied to them by relationships or by some commitment of an opportunity that you can't pass up, I would say that the East Coast and the West Coast are particularly the bigger cities and population-dense areas, are really not areas that you want to go to unless you have an ironclad opportunity that has been offered to you. I would say look at the smaller communities, the suburbs and the bedroom communities of cities, and even rural areas, if that's a lifestyle that you and your partner or you would like to investigate, because that's clearly an opportunity to make a difference, to do very well economically, and to be busy. So I would say, really, without saying that there's a definite place to go, one or the other, is to really investigate what the opportunities are. That's number one. Number two is, we know now that about half of practices are 3 or more pediatric dentists, and I would advise somebody looking for a position to not think about solo practice as much as looking at a practice opportunity with a group of pediatric dentists that practice in a main office with satellite opportunities so that they can take advantage of urban settings or more densely populated settings, hospital access, and those kinds of things, as well as being able to go out into untouched areas or areas that need access. That would be that kind of opportunity I would suggest people look strongly at.
That's fantastic. We will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing, offering pediatric restorative solutions that keep you performing at your best. For more information on Hugh Freedy products, visit www.hughfreedy.com/AAPD crowns.
We are back with Dr. Paul Casamassimo, Chief Policy Officer of the APD's Policy Center, amongst other perspectives which he has. So, Paul, I want to get back to the data the things we learned from this workforce report. And we were talking about identifying where a starting pediatric dentist should look in terms of where they might want to practice. So to get really specific, so in your opinion, where is the best place to be a pediatric dentist? You talked about kind of maybe carving out East and West Coast, but can you be more specific on that?
Sure. I would say the Midwest is probably the prime location for someone wanting to be a pediatric dentist. Some of the data that we obtained in the workforce study were based on the nature of the location. So, for example, the West Coast, California, for example, you have major cities with huge populations. Same on the East Coast, Boston, New York, Washington, D.C. So, some of the results were premised on those types of areas. In the Midwest, we don't have those major cities, or there's a lot more distance between those type of major cities, but there are many smaller cities where you have a large employment base and a patient base, and you draw from rural areas that really will probably never see a pediatric dentist. So I would say if you are interested in the lifestyle of living in the Midwest in a small city where the quality of life can be very, very good, that would be where I would say people should be looking.
So do you have a couple of those in Ohio, I'm assuming? Or they exist everywhere in the Midwest, but I imagine Ohio has a few options like that.
Yes, we certainly have around where I live in Columbus, Ohio. We have communities that are about 35 miles away from the capital city of Columbus and are desperate for pediatric dental help. The general dental community would love to have pediatric dentist access. And so if you drew a circle with Columbus being the bullseye and went out about 30 miles, you would find some small towns and smaller cities where you could set up shop and be welcomed. In fact, we have some areas in Ohio that are small towns, some cases small college towns. So there's some social life and cultural life there, who would actually help support a pediatric dentist getting started in that community. And I don't think Ohio is unique in that regard.
Right. No, I think you're right. Yeah, I think other Midwest states, as you said, that example is really important, and that's why this is so valuable to our members, and particularly our younger members. Something else that has come up a lot over the years, and particularly now as the specialty of pediatric dentistry has perhaps a majority of women practitioners. Does this study affect the projections we can based on gender now in the future in terms of workforce?
Well, yes and no. I think the study showed a number of things in all the data. One is that we are now becoming a specialty dominated by women, and certainly over 50% of us are now women pediatric dentists. That's number one. Number two is and this was not demonstrated in the study, but is really an area ripe for research, and that is how social mores have changed. And back in when I started, it was largely males who became pediatric dentists and married, and the wife was someone who raised the children and stayed at home, and the male was the one who was the breadwinner. And so today we have far more dual professional couples, and so the challenge in getting those pediatric dentists, male and female, into rural areas or smaller population areas is that you have to be able to support careers for two people as opposed to one. And we really don't know how that is going to play out, whether that's going to be a detriment to getting pediatric dentists to go out to other areas, or whether it's going to assist them or assist us in getting them into those areas. So that's one. The other thing is quality of life, and there's some suggestion out of some research from the University of Minnesota that a woman dentist or professional is the one who makes that decision and wants to have a lifestyle that is conducive to family life and child development and education, and so they may choose a rural area. We didn't necessarily find that, but remember, ours was a cross-sectional study, not a longitudinal study. So that's an area that's ripe for research to see what are the behaviors of our now predominant female specialty, and can we use those to help maintain and improve access to pediatric dental care for children.
So concerning, Paul, some of the unknowns or assumptions perhaps that, as you said, were made regarding any kind of report and how the data was gathered, other medical and dental workforce entities have experienced change, which may have been projected, and maybe it was the same or different than that which was projected. Could you put our projections into some kind of relative framework regarding those other medical and dental workforce entities?
Sure. I think one of the things that we always have to remember about our specialty, and unfortunately on some of the decision makers, what I'm going to say is it goes past their attention, but we are predominantly the number one treater of Medicaid children in the country. You can cut dentistry in any slicing way you want to, and pediatric dentists are the ones who treat Medicaid patients. 70% of us treat Medicaid patients, and the typical pediatric dental practice is about 30+% Medicaid. So without us, that system would collapse. That's number one. Number two is we go to the hospital, and so clearly with the continuation of an early childhood caries epidemic, a lot of kids need to be treated beyond just simple behavior management. And so if you don't have pediatric dentists in a community to take these kids to the hospital, you're going to be out of luck. That's number two. Number three is we are also the group that takes care of special needs patients. And even though the general dental community has awakened to the need for care of these patients at some point in their life as adults, we will continue to be the only source of care for people and children, particularly with special health care needs. So, there's no question that those kinds of things will direct, or hopefully direct, the changes in our system because in the opportunities for pediatric dentists, because we are a unique group and nobody has stepped up to provide the same kinds of constellation of services for all sorts of patients that we have over the years.
That's really interesting, and it kind of ties into what my next question is, which is, if you're going to start out as a pediatric dentist today, you'd want to manifest certain skill sets that you learned in your training or services that make the most sense to offer. And based on what you just said about the importance of our role as a specialty, can you give some recommendations regarding the retention and utilization of our skill sets in one's practice?
Absolutely. I think the one that is tantamount to good care is we see children, we see babies, we see infants, and we can truly reach the concept of a caries-free generation better than the general dental community that tends to wait until children are a little more cooperative. So that's number one. So infant oral health and understanding caries risk assessment and alternatives to letting early childhood caries develop. I think that's a skill set that we all need to have. Doing minimally invasive treatment is another one that I think we do better than anyone else in terms of arresting and preventing exacerbation of any early childhood caries that we do find. So that would be another one. The next one would be going to the operating room, going to the hospital, and being able to intervene with children and then get them afterwards into a state of health and maintain that state of health throughout their childhood. So those would be three things I think that I would say that people should know.
Those are good recommendations. We just have a couple minutes left, and I want to try to get in a couple questions real quick, if I could. And one is, when this workforce report came out, there were sort of conspiracy theories emerging that the increase in pediatric dentistry is being driven by government entities, et cetera. Can you say briefly to us what role the academy, organized dentistry in general, the federal government played in the increase of pediatric dentists over the last 2 decades?
Well, there was clearly a need 20 or 30 years ago. There was clearly a need, and the response was I won't call it a knee jerk, but it was a recognition of the numbers just weren't there. And so the programs that we worked with the federal government to develop were really aimed at generating more pediatric dentists. And the thing that many people don't realize is that when you have a pediatric dentistry training program in a community, and many went into smaller communities, that became a care source for a population that had difficulty accessing care. So not only were we putting out pediatric dentists from those programs, but we were also providing access to care where it hadn't been before. So we supported that. Now, I think responsibly, we're looking at the numbers and looking at other ways to achieve access to care and quality care for children. And not putting a dentist or pediatric dentist or a dental therapist or some other care provider, restorative provider on every corner. I think we've recognized we now have a viable pediatric dental workforce, and we need to be allowed through payment mechanisms and through constellation of agency and federal programs to be able to provide the services in the way that we were taught to do it. I think pediatric dentists can handle a tremendous load of patients and provide preventive service. And so I think as we move to maybe a value-based type of care, we are well placed to be able to get populations healthy and keep them healthy.
So we're right there with the rest of the health system. We've evolved into the mix, essentially, of the same challenges and opportunities faced by the health system as a whole. So finally, Paul, thank you so much, by the way. This is amazing, and our listeners are really going to listen to this over and over, I think, and we want to do more on this subject. But given everything you said today, and with your experience in today's landscape and with the projections being made in this workforce study, is pediatric dentistry still a good career choice? And why would you recommend it to a dental student?
I think it remains an excellent choice. You know, just as it was 20, 30, 40 years ago, you have to love to work with children to begin with. And once you've crossed that threshold and made that decision, then the skills that you get in training are useful and will remain useful for your practice lifetime. And unless we come up with some caries vaccine, which people have talked about for 50 or 60 years now, or some other intervention, your prognosis for a happy and healthy practice life is there, even with some kind of vaccine or some other type of treatment. Somebody has to apply it, and many people will choose not to have it. So there'll always be children. There'll always be a need for pediatric health care. And I would say if you were contemplating doing it and you love kids, go for it.
Go for it. Well, thank you, Paul, so much. Thank you, Dr. Casamassimo, for being with us today. Our audience and I really appreciate this.
Thank you very much for this opportunity, and I want our listeners to understand that this is your organization at work, looking out for the welfare of both our practitioner members and children in this country. And we should be very proud of the Academy of Pediatric Dentistry for its attention and willingness to look hard at what it does and where we're going. So
that's great.
Feel good about your membership.
On behalf of kids and on behalf of us as well. It all fits together. And thank you to our audience for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. It is brought to you always by the American Academy of Pediatric Dentistry. And thank you for your time, and we look forward to hearing you next time. See you soon.
Be sure to attend AAPD's annual session this May. Every year, AAPD brings together the experts in pediatric dentistry and more to provide 3 days of the best continuing education, networking, socializing, and exhibits. Visit annual.aapd.org for more information.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.